Colleagues, good morning. Firstly, I'm sorry I can't be with you in person today. I would have liked to have been there for myself to enjoy the event firsthand, as I'm sure you all will. I would like to begin with a thank you to Healthcare Improvement Scotland for organising what I'm sure will be another excellent national event. I don't underestimate how much work will have gone into this, and so my gratitude goes to everyone involved. More than that, I want to put on record how grateful I am for Healthcare Improvement Scotland and the team's dedication to the Scottish Patient Safety Programme, the SPSP, over so many years. As everybody here already knows, Scotland broke new ground when the Scottish Patient Safety Programme was begun. One thing we're all very proud of is how it was the first programme of its kind anywhere in the world. So whether you've been here since the early days or you're new on the board, you're part of something very special indeed. The Scottish Patient Safety Programme's continuing success is testament to your hard work and the work of colleagues across the country to improve the safety of care and reduce the risk of harm as much as possible. As we all know, patient safety needs to be a focus in every part of our system, in every corner of our country. In my job, I'm fortunate enough to see the work of so many different parts of our NHS. What I see around the country is so impressive, and SPSP is such a big part of it all. From the recent successes of the Acute Adult Collaborative, the first steps you are taking in the renewed perinatal and paediatric programmes, and of course the work on mental health standards, the breadth of these programmes and the results they deliver will truly impact people's lives for the better. The Scottish Patient Safety Programme has been vital to improving our systems ever since it first started, and probably more so now than it ever has been before. Your focus on patient safety has been crucial over the last few years in providing the environment and the conditions that enabled NHS Scotland to be flexible and adaptable quickly to the greatest challenge our healthcare system ever countered. And as we continue to face new challenges every day, I know the difference your flexibility and adaptability continue to make. That isn't just warm words. When I get to spend time with our NHS staff on shift, as I did a few weeks ago at the University Hospital Wishaw, I see it at first hand. Watching the team at Wishaw, it was clear to see how safe care is paramount. When people access any part of the health and care system in Scotland, they must have confidence that they will receive treatment that is effective, person-centred and safe. And I've seen how hard you work to meet that expectation. And as I said a moment ago, our services are still under pressure, partly as a result of the global pandemic, partly the continued workforce challenges, the unprecedented levels of inflation, and of course the challenging budgets we have to work within. But through all of this, you and your colleagues have worked tirelessly to keep people safe, while still working on improvement programmes to make our system even better, even safer. The Scottish Government is committed and has committed to reforming to health and care services. We know we need fundamental reform. We need to focus on delivering real change that is based on the strategic foundations we have built over the years. And that work includes the work of the Scottish Patient Safety Programme and much more. We need to think of how we tackle health inequalities, build sustainable services, and ensure people access the right services at the right time. We need to attract and retain the best staff to our NHS and reduce the unwarranted variations which persist across our system. And we need to do all of this within an incredibly challenging fiscal position. But I have confidence that we will rise to that challenge, and as we do, we will ensure that people are at the heart of it all. Not only those who access our system, but you, our valued staff. I mentioned a moment ago the work I saw at Wishaw in their emergency department. In just a few hours, I saw some of the challenges you face and the excellent work you do to keep patients safe. And I'm going to the Western General in Edinburgh soon, where I'll be seeing some of their patient safety work and learning wherever I can to help share insights across our system. For me, the lessons I learn by going out to our hospitals and health centres and clinics are crucial, but I doubt they give me the insights you aren't already well aware of. Patient safety is at the heart of everything we do, and as we all rise to the challenge in reforming the health service and the future of the Scottish Patient Safety Programme, it will be most certainly a central focus in playing its part in this. I know you will be keen to get on with today's agenda, so I won't hold you back. But colleagues, let me end where I started. thank you all for the work you have done and continue to do to make Scotland and its care and health systems safer.